Hello. Exercising after a heart attack or heart surgery will greatly improve your health and well-being and reduce your risk of further heart problems. However, it is important to make sure that you are exercising safely. When you have a heart condition, it can be dangerous to overwork yourself too quickly. The cardiac rehabilitation team will tell you what exercises you can and should be aiming to do. To help you know how hard to push yourself, there is a useful tool called the Borg scale of breathlessness. The Borg scale measures how hard you're pushing yourself on a scale from 0 to 10. 0 is when you're doing nothing at all, and at level 10 you're pushing yourself so hard that you are very, very severely breathless. You're encouraged to find activities that keep you at level 3 to 4, which is a moderate level of breathlessness. So what does Borg level 3 to 4 mean? Try and have a conversation with someone as you exercise. If you can still hold a conversation, but feel warm and are breathing slightly faster than normal, then you're probably at the right level. Your heart and health will greatly benefit from exercise done at this level for a period of time. You should aim to exercise at least 3 times a week on non-consecutive days. Try to exercise for 20 to 30 minutes in level 3 to 4. Make sure that you do a gentle warm-up and cool down. It is best to focus on lower limb exercises such as walking and stepping. These will raise your heart rate and work your lower body muscles, strengthening the muscles that you need to do everyday activities. If you have had heart surgery, you should avoid heavy lifting with your arms for up to 12 weeks after the operation, as this can interfere with wound healing. It is important to set small and achievable goals. You could start by doing activities around the house. When you're happy with that, you could go for a walk to the end of your driveway or street. You could advance that by walking slightly further the next time. Walking is the main exercise that we recommend for everyone, regardless of their condition or previous fitness level. You must only exercise if you feel well enough and have the correct equipment. Do not exercise when you feel unwell with a fever or infection, you've had a recent chest pain, you have an injury, you feel dizzy, your blood pressure is too high or too low, you haven't taken your medication, or you do not have the correct equipment. Discuss any problems you're having with the cardiac rehab team and they will be able to offer further advice. You should stop exercising immediately if you develop breathing difficulty, you develop chest pain, or you become lightheaded and dizzy during exercise. Sit down and see if things resolve over a period of time. If your symptoms improve, then you do not need to do anything immediately. However, it may be worth seeing your GP to discuss your symptoms and review your medications. But if the symptoms continue after you've stopped exercising, seek help immediately by calling 999.